Patients who are planning breast augmentation will often ask about the plan for the location of the scar. Because anytime we place an implant, we will have a line or a small scar where we accessed the inside of the breast. The most common location for opening the breast to place an implant is along the inframammary fold. If the fold scar is planned correctly, that short 4-centimeter line can be located exactly where the breast skin meets the chest wall. This is a well-hidden scar, and it's my preferred scar location for several reasons. The first reason I like the scar location is that you have the lowest chance of capsular contracture or tightening of the implant over time. This is because the implant is kept far away from the nipple, where bacteria are possibly going to touch the implant or affect the implant, creating a higher risk of tightening of that breast pocket over time. The second aspect that I like of an inframammary fold incision is that patients who have a scar along the fold have a lower incidence of nipple numbness or changes in nipple sensation. Many patients have sensitive nipples, and this can be an important part of intimacy. When we place the scar along the fold, we have the lowest chance of disrupting the nerves from the chest wall to the nipple, and we have a lower chance of changing the sensitivity of the nipples. So for patients who feel that their nipple sensation is an important part of intimacy, we should choose the inframammary or fold location for the breast augmentation scar. Some patients want to hide the scar and not have an incision on the fold along the breast. Another location that's popular is actually at the border of the areola along the nipple. A breast areola scar is a line, a 4-centimeter line at the border of the brown areolar skin where it meets the white skin. This is a very privileged healing area that heals very fine line scar, difficult to see. But it does slightly increase the risk of capsular contracture because this procedure goes through the glandular tissue, and there can be a slightly higher incidence of bacteria in those ducts of the breast that can affect the implant. Also, this can reduce the sensation of the nipple or the ability to breastfeed later. The umbilical augmentation is an opening in the umbilicus in which they use a scope to look into the breast, open a pocket in the breast, and place an implant. Historically, this was often done with a saline implant because it could be done through a small tunnel. I highly don't recommend this option. It has a very high incidence of asymmetry and a pretty high incidence of capsular contracture or contamination of the implant with skin bacteria. Because asymmetry causes a great deal of breast implant dissatisfaction, even 1 centimeter difference in the height of the implant, the height of the breast, or the nipple position, or for example, nipple laterality, all of these things create a great deal of unsatisfaction in a patient. And because predictability of implant placement is very challenging for most surgeons when they go through the belly button, I recommend we don't use this technique. The last option we should talk about is the axillary or transaxillary augmentation. This is the armpit incision augmentation. Here in Texas, where patients wear tank tops 9 months out of the year and we spend a great deal of time in bathing suits and other light clothing because of the hot weather, I don't recommend we place implants through the armpit. You still have the possibility of implant malposition or breast asymmetry. You do have a low incidence of capsular contracture, but the scar in the armpit is very visible to the patients for the rest of their life. Armpit scars don't heal well because the arm is a mobile structure. Your arm lifting and pulling and moving in its normal activities of daily living will cause a widening potentially of the scar that creates a very visible line in the armpit anytime you wear a tank top, bikini, or other strapless dress. I don't think that armpit scars are attractive, and I don't recommend an armpit augmentation. Transaxillary augmentation leaves a scar in the armpit on both sides, several centimeters long, that's visible for the rest of your life. I think this is unsightly, especially if you're in a climate like Texas where you're wearing sleeveless shirts, tank tops, bathing suits 9 months out of the year. I don't think that a procedure that creates a high likelihood of an asymmetric breast and has a visible scar forever in an area that is seen in regular clothes is a good idea. My favorite technique is the inframammary fold incision, which is hidden right at the margin of the skin of the breast where it meets the chest wall, right where the underwire of your bra typically leaves a line anyway. We put a very short 4 centimeter, less than 2 inch long incision. We use a scope through that incision, create a perfect pocket under direct visualization, get a controlled position for the implant, and get the best augmentation result in the first procedure.